Hello, beautiful ladies. I am Dr. Jayanti Kamat. I'm an IVF consultant and obstetrician and gynecologist since the past 22 years. So today we'll be talking about a very important topic, that is miscarriage. As you know, that pregnancy is a very joyful event for the woman, the couple, and the entire family at large. But whenever there's a disruption in pregnancy or a miscarriage, it causes a lot of agony, a feeling of guilt, and a feeling of having done something wrong. So today we'll be discussing about what is the definition of miscarriage, what causes of miscarriage, can all miscarriages be prevented, and what are the risk factors for having a miscarriage, and how do we prevent. So firstly, we come to the definition of miscarriage. Miscarriage is defined as the spontaneous expulsion of the fetus before 20 weeks. Now, this miscarriage has been divided first trimester abortion and second trimester abortion. First trimester means the first 3 months of pregnancy, and second trimester is between 3 to 6 months. Normally, the incidence of miscarriage is 10 to 15%, but actually it is 50% because some women, they abort the fetus even before knowing that they are pregnant. Now, what are the causes of miscarriage? Now, firstly, we'll come to the first trimester miscarriage. First trimester is early abortion or abortion in the first 3. So the first main cause is genetic or chromosomal cause. Chromosomal cause, the parents may be normal, the mother is normal, but as you know, what happens is, we all know that it takes a single egg and a single sperm to make an embryo. We all know that it takes a single sperm and a single egg to make it, and the embryo inherits 23 chromosomes from the father and 23 pair of chromosomes from the 23 chromosomes from the mother. But sometimes in this, one chromosome may get added extra, or one chromosome may be subtracted or deleted. So this results in defective fetus. Or suppose the oocyte or the egg is defective or the sperm is defective, it will result in a defective fetus. And tries to get rid of this particular defective embryo. We all have read in evolution, in the theory of evolution, that it is survival test. So whatever is fit or whatever is fit will survive. So that is nature's way. The second cause of abortion is the hormonal deficiencies or hormonal defects. So sometimes, as we know, in a woman's body, there are two main hormones, that is estrogen and progesterone. Sometimes there's a deficiency in this progesterone hormone, and progesterone is responsible for sustaining the pregnancy. So when there is deficiency of progesterone hormone, it is also called as luteal phase defect, and if it goes undetected and without treatment, it may cause first trimester abortions. The third cause is the hormonal problems. Suppose the patient is having thyroid problem or uncontrolled diabetes. So thyroid problems in the sense, if there is excessive secretion of thyroid hormones, hyperthyroidism, or there is a very low of thyroid hormones, that is hypothyroidism, or suppose there is some inflammation of the thyroid gland called as thyroiditis. So this causes a lot of antibodies and will not allow the fetus to survive. So if these conditions are not treated, if these conditions are well under control, then they cause any abortion. But suppose they are not diagnosed or they are not treated properly, it can cause abortion. Secondly, diabetes mellitus. Diabetes mellitus, if the sugar levels are not normal at the or not under control or not detected at the time of conception, it can cause abortion. Diabetes is also associated with chromosomal anomalies. Then PCOD also. PCOD also, if there is defective formation of oocyte, again that will lead to defective embryo. That will again give rise to uh, abortion. Then there are certain immunological factors, and there is syndrome called as the APLA syndrome, in which there is production of antiphospholipid bodies. Now, this antiphospholipid antibodies, what they do, that we all know that the fetus depends on the mother for its nutrition supply. So, how the mother will give nutrition to the developing fetus? It is through the blood vessels, and blood which is flowing between the mother fetus, that is the placenta. So, because these antiphospholipid antibodies, they create small clots in this blood vessels, and because of clot formation, there is no proper blood circulation to the fetus, and hence the fetus dies. So these are the various causes, and plus there are environment as well. Suppose a woman is exposed to some toxic gases or radiation, that will also cause abortion. Then lifestyle habits. Lifestyle habits is excessive of alcohol, excessive intake of habit-forming drugs, and excessive intake of caffeine. All these also can cause smoking, especially. These also can cause abortion. Then, what is the commonest cause in the second trimester? And before I come to the second trimester, another factor which is very, very important for abortion is what I mean by age is age of the woman. And why age of the woman is a positive risk factor for abortion is because suppose is in the 30s, 20s, the risk of abortion is 10 to 15%. Suppose the woman is in the 30s, her risk will be about 20%. If she's in the 40s, her abortion risk will be as high as 40%. And how does this is? Because after the age of 30, we all know that a woman's reproductive capacity decreases, or the number of eggs, or the quality of eggs, it undergoes a change. And so the quality of eggs is not good after the age of 30 or 35. The number of eggs are very few. So when the quality of the oocyte or the egg, so when the quality is not good, definitely it will lead to an defective embryo. We have all heard of babies of Down syndrome being born above the age of 35. So here, ladies, you have to take care. Please plan your pregnancy at the right age. Then, about between 4th, 5th, and 6th month. What happens here is the commonest cause here is the cervical incompetence or the structural anomaly or abnormality in the shape of the uterus. Now, cervical incompetence is cervix is the mouth of the uterus. It is it acts as a plug to keep all the contents of the uterus inside the uterus. And this cervix should open at 36 weeks or when the woman is in labor for the fetus to come out. But sometimes what happens is this cervix is very short, it is very weak. So once the pregnancy grows and the weight of the baby grows, the cervix cannot bear the weight of the fetus and it starts opening up. And suppose this is not detected, then what happens? The cervix opens up and all the contents of the uterus come out and cause abortion. Then structural abnormalities of the uterus congenitally or since birth. If the woman has a defective uterus, she has a unicornate uterus or a bicornate uterus or a partition inside the uterus we call as the septic uterus. So because of these abnormalities, there is not enough space for the fetus to grow inside the uterus. So that will abortion, or if there is a very huge intramural fibroid, that also will not allow the fetus to grow because it occupies the space which is meant for fetus to grow, and that also can cause abortion. Now, when should we really know the cause of the abortion? Like when should we really investigate? So, according to our textbooks, they say that when a woman has 3 abortions in a row, recurrent, she's going on having abortions. If she has more than 3 then only we should investigate as to why the abortion has occurred. Because if it is a genetic, if the abortion is a chromosomal abnormality, there are very few chances of that chromosomal abnormality repeating in every pregnancy. So she may have 1 abortion, but then her next pregnancy is normal. So in our textbooks, we say there are after 3 abortions we should investigate the matter, but practically it is not so because the patient becomes very anxious. So usually after, even if a woman has had 1 abortion, when she's trying to get pregnant for the second time, it is always better to have a pregnancy, and she should do this planning 3 months before she's actually planning to conceive. All doctors give the advice after 1 abortion to take a second chance. There should be a 3 months gap. Then, now coming to the symptoms of abortion. The symptoms of abortion can be either it can have symptoms or it does not have any symptoms. The woman doesn't even know that there is some problem. It goes for a sonography and discovers that there is an abortion or the fetus is not growing well. Now let's come to the symptoms. The symptoms can be bleeding may be either just spotting or moderate bleeding or heavy bleeding. Then different types of discharge, either a pinkish discharge or a brownish discharge or too much of watery discharge can also be an early indicator of abortion. Then coming to the pain. Pain may be either a pain or severe pain or a dull backache. So it can be associated with pain. Third symptom will be the passing out of pus. Like you can see some small pieces which are passing out. So these are the various symptoms of abortion. But whenever you something, bleeding is not at all normal during pregnancy because a lot of women, what I have found is that thoda sa bleeding ho gaya, it was hardly a dot and it was a spot, and they ignore this bleeding, and then this can lead to further complications. So whenever you see something which is different from the normal, please consult your doctor, let him know what is happening. Even if you would have consulted her just a day before, but still, if you are having bleeding or spotting, please consult your doctor. Now let's come to the different uh, uh, different types of abortion. Now, before I come to the different types, let me tell you what not doing for an abortion. A lot of people have this feeling in their heart, okay, because I have eaten this, that will cause an abortion. Because I have eaten that, that might have caused. So let me just burst the myths. Exercise. Even if you do mild to moderate exercise, unless you have been strictly advised bed rest by the doctor, that exercise is not going to cause abortion. Then many couples ask whether sexual intercourse has given rise to abortion. So sexual also will not cause so sudden an abortion. Then third is eating stuff like some people say that hot food, like suppose mango, eating eggs, eating chicken, eating papaya. So will that cause an abortion? No. Whatever you are eating will not cause an abortion. There is nothing like hot and cold food. As far as papaya is concerned, remember that a ripe papaya is a very good source of vitamins that can be eaten by the pregnant woman. But the raw papaya contains a certain enzyme, and that enzyme may be responsible for the contraction of the uterus. So papaya has to be avoided, otherwise you can eat everything. And now coming to the different types of abortion. So let's know what are the different types. One is the missed abortion. Why I say missed abortion? Because why do we missed abortion? That is because in missed abortion there are no symptoms. A woman is very happy that she's pregnant, and then she just goes for a sonography, and there the sonologist tells her that there is no heartbeat, and the fetus has died a few weeks before, or the fetus is not corresponding to the period of gestation, or the period of to the period during which she is not having any menses. So the number of months which she has calculated, the fetus corresponding to it, and it has stopped growing long back. So this is a very devastating news to the mother, because she has just gone for a sonography, she is not prepared. So that is called as missed abortion. Then the second type of abortion is threatened abortion. Threatened is when the woman has a slight bleeding, and then has a very mild pain. And this type of abortion can, it can, the baby can be salvaged if she consults a doctor. Then with some treatment she can go to 9 months and safely deliver the baby. But consulting doctor and being under medical supervision is extremely important. There are a lot of women who think that a little bleeding is okay. Since the bleeding was just one spot and it has stopped, I need not worry. It is not the case. Please be in touch with your gynec. The third is inevitable abortion. Inevitable means the abortion is bound to happen. You cannot stop the abortion. So what are the symptoms of inevitable abortion? There is severe pain, there is maybe some disease also, there may be bleeding also, it just cannot be stopped. So that is called as the mouth of the uterus is already open, and any time the products and the fetus is to come out. That is called as inevitable abortion. Then the another category is the complete abortion. The woman suddenly has passed out whenever the bathroom, she is suddenly passed out a lot of clots, fetal material, and then the bleeding stops. But even then, you should not think that, okay, the entire thing has come out, so it is okay. I don't have any bleeding also, so why consult a doctor? No, you must consult a doctor. The doctor will do a sonography whether the uterus is completely empty, and will also call you for a follow up after 15 days. Then incomplete abortion. Incomplete abortion is the woman has passed a few products, but half the products are remaining inside the uterus. So whatever products are remaining in the uterus, those also have to be evacuated. And the symptoms of this is heavy bleeding, passing a few clots, and pain in the abdomen. The most type of abortion is septic abortion. Here, septic abortion, what happens is the woman has spotting or a little bleeding. It stops on its own. She does not need treatment. She does not show to any doctor. And then what happens is the pregnancy does not continue, but since it is in a long time, the products get infected. And then she may have foul smelling discharge. She may have severe pain abdomen, or she may get high fever with chills and dryness. So these type of cases, they have to see a doctor immediately and require admission. Otherwise, it may lead to life-threatening consequences. Now, what is the treatment of abortion? So before I go to treatment, let me talk about prevention and let me talk about risk. As I already told you, the more the age of the woman, the more chances of abortion. Secondly, if the woman has any medical disorder, suppose thyroid problem, diabetes, hypertension, then she has to see to it that all these diseases are controlled. Plus, she should ask a doctor whether she's going to change the drugs since she's planning to conceive. And all this should happen before she's actually planning to conceive. I tell all women that preconceptional care is extremely important. It is not that we do for everything in life. Even if we are going to go for a short trip anywhere, we do all the planning. But when it comes to pregnancy, people just don't plan. They feel that it is so natural, so normal. But no, you have to plan for a pregnancy also. You may have some vitamin deficiencies. You may be anemic. You may be overweight. There were certain things which you may not be knowing that you're suffering from that particular disease. So normally when we do our thyroid levels, we find so many women who are hypothyroid, thyroid. We find so many women who are in the pre-diabetic stage. So preconceptional care and preconceptional counseling is very important. As we know, when the farmer sows his seeds in his farm, he first prepares the soil. So it is something like the seed and soil concept. So whenever a farmer has to grow some plants, he will first prepare the soil. He will not just throw the seeds into the soil for a good tree or a good plant to come up. So similarly, Before you conceive, you should make your body as healthy as possible so that your child will be normal, your pregnancy will be normal, and you will have a proper normal delivery. So this is very important. Then coming to the treatment. Treatment is if it is missed abortion, which I discussed first. Missed abortion is that you have to eat the uterus. If it is incomplete abortion, then also we have to undergo either it can be done by tablets or whether it can be done by DNC. And your doctor will decide on this what has to be done. Septic abortion, it requires urgent admission and evacuation plus antibiotics and all that. So, with this, friends, my take home message is please conceive at the right time. Age is very important, and whenever you're planning to conceive, please consult a doctor 3 months before you're actually planning to con- conceive. Okay, so now if you haven't or if you have liked this video, please share this video. And now, if you have any questions, you can ask. Yeah, questions, please. Yeah, Rachana, you have asked me what week is the highest risk of miscarriage. So actually, the first trimester abortion between before 12 weeks, that is the period where that is the highest rate of abortion. What should you avoid during your first trimester? First of all, you need to be under medical supervision. There are a lot of people who think that let me go to the doctor only 7 months pregnant or 4 months pregnant. No. The moment you know that you are conceived, your pregnancy test is positive, please consult your doctor. She will examine you and tell you what medicines you have to take, and she'll also tell you according like what care you have to take because pregnancy is different from each and every woman. You need a healthy diet and have good sleep, eat a nutritious diet, do a little bit of exercise, and keep a calm mind. Yes, questions, please. What precautions should one take to avoid miscarriage? Yes, Lakshmi, I have already mentioned that the first thing which I will say is planning, planning, and planning. You have for a pregnancy. So you have to plan for a pregnancy, and in that planning period, you have to have a good diet, good sleep. If you're overweight, lose weight. A few investigations done to ensure that you're not suffering from any vitamin deficiency or any hormonal problem. Yes, next question. Next question, please. Yeah. Smiley, yes, you're 9 weeks. Congratulations. But you're facing blood spotting. Okay. Have you consulted your gynae about this? If you're having blood spotting, the doctor might have given you certain progesterone injections or some pessaries. So please use them religiously and try to get rest as much as possible. Counselor for a miscarriage, yes. First of all, you consult your gynec, your local gynec will advise you on which counselor to go to. How do you know you're having a miscarriage? As I told that miscarriage has to be mostly diagnosed by a sonography unless it is something like an inevitable or an incomplete abortion. So, if you have any spotting or any watery discharge, any foul smelling discharge, then you can suspect a miscarriage. That finally it is found only by a doctor. Yeah, is my body to blame? No, actually, a lot of women have this guilt saying that, I cannot carry a baby, or I have done something, I ate this thing and that has caused miscarriage. No, you should not blame your body at all. First of all, as I said, try to get healthy as possible. So you try to take care of all your deficiencies, try to keep your weight at the optimum, and plan the pregnancy stage. That is the single most thing which you have to take care of. How can I reduce my risk? Risk of abortion can be reduced trying to conceive at the appropriate age, and especially before 30, then eating good food, then having good amount of rest, getting periodic tests done so that you are not suffering from any hormonal deficiencies or vitamin deficiencies. The best is you have to consult your doctor who will guide you and for preconceptional care as well as preconceptional counseling. So by that way, once you are prepared for pregnancy, then obviously whatever has to be, whatever risks are involved, they can be taken care of even before you conceive. So that risk of abortion. Will my body be affected after miscarriage? Now depends on what is the duration of your. Suppose you are aborted early, so that will cause a little blood loss, and you can get back to normal with precautions. But if suppose it is a second trimester abortion, and if there is more amount of blood loss, then you will take a little longer time to come back to normal. But as usual, there should be at least 3 months gap between one pregnancy and the next pregnancy when there is an abortion. No, hormones can be taken care of. Your hormones can be taken care of by modifying a few lifestyle habits as well as medications. Yes, prenatal supplements are recommended, especially folic acid. You have to check whether your even vitamin D and vitamin B12 levels are before you try to conceive. Thank you. For any more queries, you can